Welcome to the girls. We're at Hazelton's Hotspot. We are at the Dragonfly Cafe here right on Broad Street, and we're enjoying a nice cup of
double espresso.
Oh, and I have the decaf espresso, so for anybody who is decaffeinated like I am, you could still enjoy it.
So watch the whole show, because by the end I'll be climbing off the wall.
Oh, like something isn't new.
Yeah. So what's new, Mama?
What's new? Well, let's see. I got some new telephones for my house.
Ooh,
new
exciting.
technology. I have them all queued up so that it announces when someone's calling. It tells me who's calling. I have a bathroom. I have a phone in the bathroom now.
Oh boy.
My other phones weren't bad, and when we got these phones, I thought, well, let's just see if we could sync them all together. So now I have a phone just about in every room in the house, so I don't have to be losing a phone. And
Do you have a
Sam
phone for
Jr.
the dog?
I do. I don't have a phone, but I have something for the dog on my phone.
Neat.
Sammy Jr., Lori, and Bella bought cameras for us that you could use in your home. It's that D-Link stuff. And so I finally got those all hooked up and synced up and whatever. So now when I go out, I could check in on Gucci and see where he is in the house, because sometimes I just like to, keep an eye on him.
He's so cute.
So it was a very techie weekend for me. I don't know about you. What did you do?
Well, it's always juggling the kids and my events, so we had that, and then I went for a run. And
what else is new?
Right, I went for a run, but I'm very careful because everyone says be careful outside, don't get hit by a car, watch for ice, watch for this, watch for that. So did my, my 6 miles, and then I went to my car to get in, and I wiped out. Did you ever take one of those falls where you literally laugh? It hurts, but you laugh so hard at yourself. So I thought I actually broke a couple knuckles, but I think I'm just bruised. So I'm all right.
So you ran fine, and then
I
when you
ran
got
fine,
to the car.
and I get to the car, and did you ever have one of those falls where you're literally under the car?
No,
And I got
God.
up so quick to jump in my car because I was so embarrassed. And you look around like, I don't even care if I broke my rib. I'm getting in the car first and
Did
crying.
anybody see you?
Not that I know of.
Gosh, so
Or
are you
if they
sore?
did, they'd probably be laughing.
Are you sore?
A little bit. Just a little bruise, but we're okay.
Well,
But while we're talking about like little things, we have our Sophie collection on. We have our Endless collection
From
on.
Sophie Jewelers.
I love these.
I do too. It's really great with these because this is called the Endless Collection. They're made out of leather, so they're very soft.
And
I
they're
couldn't
light.
wear those Pandora bracelets because they're real heavy, and then until you put all the charms on, it's like, a
Right.
weight. So these are made out of leather. They're very light, and you can put charms on them. So
Yes.
they're very charmingly beautiful.
And you could fit these charms on your Pandora bracelet as
if
well.
you do have that. These look nice between the Annie and Alex and Ani bracelets
They're pretty too.
And the other bracelet I have on is, remember me talking about that our family in Italy is from Onzi? Well, these come from the Onzi collection, and they're made out of agate, which is mined there. And that's what this gorgeous necklace and earrings are too.
And I believe this is Amosiani. if I'm saying it
Amosiani.
correctly, but these are interchangeable. And big this year, if you're following the girls, is layering for your nails, layering for your clothes, and also layering for your jewelry. So these actually, it's nice because the necklace, you have to take the necklace out of the charm first to unlock it, and then the charm goes inside.
Isn't that
And
cool?
some of them are even reversible.
That's cool.
So neat. So along with, that's how I kind of camouflage all of my bruises for falling and injuring myself.
With jewelry,
and just
so-
put on some jewelry.
Are you giving hints to Mark
Oh
and
yeah,
Sammy?
this is mine. I'm just saying, this is gonna be mine. This is probably already mine, but this I want for Mother's Day.
Well, you're Neenlo.
Neenlo, yes, it's the J-Lo collection.
Yeah, Neenlo.
So I'm Neenlo, love it.
Hey, and while we're throwing things out there, let's not forget our beautiful flowers here from Smith Floral in West Hazelton. They are Cymbidium orchids. Send those to someone you love today because orchids always make the day. I know when they were delivered here, everybody went crazy over them.
Love it. All right, today's guest. We have a guest on with a hot topic for kids. We figured we could incorporate some children topics since
Since you're a big kid.
Since I'm a big kid and I have a couple kids and you're a grandmommy.
Yes, I am.
So our guest is?
Dr. Childs. Dr. Childs, what an appropriate name, Dr. Robert Childs. He has been a pediatrician in the Hazelton area for years and years and years. I know him, I'm going to say at least 40 years that I know him
Wow.
personally.
Right, because I'm
40.
40. So
Exactly. So he's been here a long time with us. He's very well known in the area, and he's going to give us some tips, and we're going to ask him a lot of questions. We're going to grill him. So stay with us because when we come back, we have a lot more show for you. Welcome back to the girls. As promised, we have a distinguished guest with us today. We have a very noted pediatrician in our area, Dr. Bob Childs, and he is with us today to talk about some great things. Thank you for taking some time out of your day, Doc. I know you're very busy.
Thank you very, very much for inviting me. It's a real honor to be here.
Well, thank you so much for taking the time. I know a lot of parents out there are wondering, as many of us are. I've been wondering myself because I'm a nurse and I know what I was raised with, and I know how we were raised with immunizations. A big thing right now is immunizations, to do it or not to do it. In the whole world, everyone is wondering what to do. So we want to know that being that you take care of children from birth, what should we do? What is the rule of thumb on that? Where do we start with this?
Thank you again for asking. The question of immunization, as to whether or not it's effective, there's no question it's effective. The documentation is there. It works. You know, if you talk about comparisons of countries, we would speak of prime countries, Japan and England, compared to the United States. Much smaller countries have canceled out immunizations, for example, for pertussis for 2-year periods, and ended up with 5 times the complications and deaths that we have in this country. It's during the same period.
So that was after they canceled giving the pertussis.
That's correct. Okay, so there's no question about the effectiveness. The question, again, many times becomes one of personal right versus community safety. We in this country, we're very, very much into the personal right to make choices. And that's not a bad thing in general. The question comes as to when does that become a problem for the community as a whole.
Well, I could remember, if I may interrupt for 1 second, I remember before I enrolled my children in school and before I went to school, we had to have immunizations. It was required by law that we be immunized. We had the DPT shots and all the other things. We had to be updated on all of our shots, and we had to come with a certificate saying that we had them. So when did all of that get a little more lax? When did they start giving people the choice?
And does religion play a role too? Because that is one of the issues that people are looking at, that you know, it's not their tradition, it's not their religion, and that's where we get into some gray areas.
Well, you know, and you bring a very important point up here, Janine. The problem that we've run into is going all the way back to when the laws were established for having your child immunized when you started school. The question of medical exceptions. Certain children have immune diseases that doesn't allow, that keeps them from getting their immunizations, and then religious exemptions that you mentioned. Those were always in the law. What's happened is that has now mutated into a situation where you now have personal choice.
How does that affect, doctor, when you're looking at people who are getting their immunizations, like my children get their immunizations, and then the people who don't get their immunizations, living in the same community, you know, walking the same streets, going to the same schools, going to the same churches, going to the same events? How does that affect the community and their risks?
Well, the thing that you should be aware, of course, is that immunizations are not 100% effective in terms of the take rate.
Okay.
Okay, if you take the measles vaccine, for example, it's somewhere around, say, maybe 96% effective. Okay, now, if you end up then with a child in the community who has measles, a child who is unimmunized who has measles, and your child happens to be one of the 4% where the measles vaccine didn't take, and your child gets the measles, okay, and there is some serious consequence of it, whatever it may be, whether it's brain damage or whether it's forever damaged lungs, then who pays the bill? Who ultimately comes back and has to pay that bill? And that's been an argument, particularly on the West Coast. There are a variety of very angry parents there who say, we did what was right by our child. You chose not to do that. Your child gave my child a serious illness. Okay, your fault. Okay, and that will get tested out in the courts, I'm sure.
And doesn't it also affect the elderly as well? Because the children and the elderly are always susceptible to any disease that goes around, so it can actually take someone's life.
That's correct. And the thing is, when you talk about the elderly, on 2 fronts. Number one is that many of them, when you start talking 80 and 90-year-old people, there were no immunizations available for them.
Right.
Okay. When you start talking about individuals who've been on chemotherapy before, many times the immune response they got initially to a vaccine is gone, so that they come back after the chemotherapy, they survive the chemotherapy, but they're no longer immune to some of the things they were.
Do you know what the law is as far as Obamacare or the laws that we're looking at as far as pushing either making it mandatory for the immunizations?
You know, I'm not sure, Janine, that there's been any change in the approach to immunizations under the Obama law.
Okay.
The role of the government has been to establish laws of the nature you're talking about with immunizing everybody before he or she goes to school. And that really hasn't changed. The government remains a major pusher of the vaccine for all children type of approach.
So they're covered. So everyone is covered for immunization.
Right, because again, the cost of these illnesses, when you talk about the individual cost, when you talk about the cost to the community, is quite significant. It's not no small item to be discussed.
So again, any child is able to get their immunizations. So cost isn't really a factor here on why they're not getting them.
The cost is not a factor, that's correct. But once again, I do have to point out that some children cannot be immunized because they have underlying illnesses that preclude that.
Okay.
Some that are born with underlying immune deficiencies, in other words, they can't respond to the vaccine. Okay, and the vaccine, if it's a live virus vaccine, can cause damage to them.
And the WHO, the World Health Organization, I'm sure has had a handle on all of this, just seeing how it is with the third world countries not having access to these immunizations, whereas we do. So what is the relationship there? I mean, we've seen that in third world countries, the damage that it has done, and yet we have the advantage to take them. Why would someone back off again? You know, to us, I guess it doesn't make a lot of sense, but everyone has a choice and it still is up in the air.
That's correct. The thing here is that there are individual situations where there have been bad outcomes involving vaccines. Again, at the same time that we were seeing Britain and Japan go through 800 cases apiece of damaged people, either dead or no longer functional. At the same time, we had in this country 160 such cases. Now, if you're one of those 160 people or families, you're going to say to yourself, well, gee, this wasn't worth it, not for my family.
Now you're saying side effects that one could actually be death.
Of the illnesses, oh yes.
Okay.
Yeah, if you get pertussis.
Of the illness.
Yeah,
now, are there side effects or other side effects to the immunizations? My son has allergies, so I read up on things before I get any of his shots because he has some allergies that I am concerned about. So getting immunizations, could that have any effect on your child as far as any, serious side effects or any minor side effects?
Sure. To mention my own experiences, we've had one young lady who got what was supposed to be a rubella booster when she was in her teens. Now, rubella is an illness as well as a vaccine that is noted for being able to cause deafness. Vaccine not very often, the illness very often if you happen to get the illness itself. She ended up deaf in one ear a month after she got the booster, and that was declared by the government as being a side effect of the vaccine. The family was paid a great deal of money to make sure that she got as much rehabilitation for that ear as possible, and it worked that way. Now, you should be aware that there is it's a database, if you would, called the VAERS system. And if you ask me what all the letters stand for, VAERS. Yeah, there is a nice little form that's available that you can get online. They have a 24-hour toll-free line that you can call. But what they do is they collect data from all over the country. So they don't just collect from Hazleton, they get New Orleans, they get Los Angeles, they get Minneapolis, they get wherever from the country. And what they're forever looking for is anything that is a common complication. Something that is, they look at each individual case, because if you have something that is a recognized complication, and your child happens to be the one that suffers from it, it doesn't make any difference about the other 800 out there that got their lives saved. You still need to be compensated, your child still needs to be rehabilitated.
Just like with side effects for medications. If you don't report it, they're not going to know about it, so they have to be reported.
And this is a data bank that collects that information. Does it ever pull a vaccine off the market? Yep. Back in the early 2000, 2001 range, there was a vaccine against rotavirus, which is the commonest mean virus that causes trouble for the bowel tract in the middle of the wintertime. And they began to notice that there were too many reports coming in of children who subsequently suffered from a complication which is called intussusception, where the bowel tract essentially telescopes into itself. And they pulled the vaccine off the market because of that. So there is somebody out there who's monitoring. There's somebody out there who is able to look at a vaccine and say, no, this vaccine is not a good vaccine, it needs to be removed. And they also look at the individual cases. So if your child suffers from a problem that is vaccine related, they'll take a look at the situation. They'll get the infectious disease experts to work with them. And those individuals will then say, oh yes, we've seen this before, therefore your child needs to be compensated financially for whatever you can.
All right, well stay with us, because when we come back we're going to find out if the side effects from some of the immunizations could cause ADHD. We'll be right back. Welcome back to the girls. Our guest today is Dr. Bob Childs. He is a noted pediatrician in our Hazleton area here. We're at the Dragonfly Cafe. We're having a cup of java and discussing about important things.
Talking about kids, talking about health. Everyone cares about their kids' health, right?
But we're not kidding around when we talk about some things, especially ADHD, Doc. What is ADHD for our guests watching?
The initials stand for Attention Deficit Hyperactivity Disorder. For very practical purposes, it involves inability to pay attention, and it involves impulsivity. If you walk by a stove and there's an orange burner on, your thought is, that might be hot. I'll put my hand across the top. Child with ADHD is likely to go, okay, it's thought before. It's action before thought, and that's called impulsivity, and those are the two prime characteristics of ADHD. The thing that has been looked at over the years as being a prime symptom, I don't consider it to be necessarily that way at all, and that's the activity level. Because you can have children who are very bright, very active, and quite able to focus, okay, and they move a lot.
So how do you definitely diagnose this, being that a lot of children have those characteristics?
Right. There is no specific diagnosis. It's not like I can do a strep screen on your throat and find out that you have strep throat. What is currently being used are what are called Connors forms. A gentleman by the name of Dr. Connors, a psychologist, developed forms that you give to parents, to teachers, and perhaps to other people who are in the child's environment. And what you do with those forms is that you go down through a list of questions. You mark them off as being 1, 2, 3, 4 in terms of their intensity for that particular child.
So it's like a screening.
That's correct, but it turns out that of the 80 questions you as a parent might answer, that only maybe 12 of them really are related to ADHD. Only you don't know which they are.
Okay.
And when it comes to the teacher's version, which is a little shorter, by the way, it's about 65 questions, same thing. Teacher doesn't know which questions are related to ADHD. So what you do then is you take a template, you lay it over the top, and you say, okay, these 12 are the ones we're looking at. Let's see what the numbers are at home and at school.
A formula is great, but do we over-diagnose for ADHD?
Oh yeah, no question.
Back in the day, it wasn't ADHD. It was they're being a kid.
Or it was a behavior problem, or it was hyper.
Problem.
Yes.
Right, and again, there's so many factors that play into this, and it becomes important to kind of recognize that when you're the physician involved or otherwise. You're exactly right. What happens is that it's estimated that 4 to 6% of kids in the country have ADHD. We don't see that. We really just don't. 2%, maybe. Okay, but the thing that you have to realize is that there's a social background to this whole business too. If you have true ADHD, no matter what situation you're placed into, you're going to have the symptoms. If you're dealing with a situation where you have a child who comes from a family that is torn apart by marriage problems, by drugs, alcohol, whatever it may be.
There's a lot of psychological things.
That's correct, and that child is never going to pay attention in school. I don't care how many.
So knowing your child's background, there's a lot that goes into it. Not just diagnose the child has ADHD, they need to be on medicine. It's more. Sometimes I think it's more of attention to the child's needs, right? You mentioned it. Your child can be very bright, and I know all my friends who have boys. Most of them are all rammy to begin with.
Well, and again, the child with ADHD has very little capacity to focus in on much of anything.
Okay.
Okay, and so that child frequently does not have very many friends because, you know, if you're playing baseball with a child who has ADHD and he's sitting in the outfield blowing dandelions, catching flies. But the thing that you should realize is there's certain rules about ADHD. Number one, it has to be recognizable before age 7, otherwise it's not ADHD. Now, recognizable doesn't mean it's treated. It just means that all the symptoms were there. Number two is it has to occur in different settings. So it's not just in school, and it's not just at home. It's got to be both settings.
Kids act differently sometimes at home than they do in school.
No
so
question.
that's a good point.
No question. Number three thing is that you need to, if you have a child that you think has problems with attention, one of the things that you need to do is to get to your educational psychologist from this school district to test that child, because learning disabilities, where you have information coming in through your eyes or through your ears and it's not being handled properly by the brain, can act just like attention deficit disorder. If you have a teacher standing in front of you speaking and talking to you and you're not processing the info coming in.
Sure, some kids learn differently. Some kids learn by doing, some kids learn by listening, some kids learn by reading, right?
That's
so
correct.
It's all different forms,
That's
different
correct.
senses.
That's right. And many of those youngsters will, for example, do very nicely at home, but you put them in a classroom and they can't function.
Right.
Well, I know there's medication to treat ADHD, but does diet also help with it?
The current thinking is the diet helps very few. It may help a very small percentage, but not very many. You're correct, medication is kind of the gold standard when it comes to treatment. However, you don't just jump into using medication for a variety of reasons. First off, you do need to know for sure that you're treating ADHD. Your Connors forms, your educational psych forms, which, by the way, the state mandates if the parent asks for its psych testing to be done, it has to be done within 60 days. Many parents are not aware of that.
No.
But that's going to help you with diagnostics, with your diagnostics. But once you've done that, you still need to sit down and talk to the parents about what you have effective out there to work with. Medication, yeah, but medication has some side effects.
Right, everything has side effects.
Well, when you talk about the stimulant medications you're working with, if you think of a very strong form of caffeine, in many ways it's like that. It's
Strong form of caffeine.
Well, if you take it, you'll be able to feel the hair on your arms moving. Okay, you'll be able, you'll be able to stay awake for hours on end. So it's an abusable. These stimulants are abusable drugs. They work very nicely for the kids with ADHD, but they do have side effects, including loss of appetite. That's a given. Okay, loss of appetite is going to be something you're going to see in 9 out of 10 kids who are on stimulant medication.
And how about insomnia?
Can be, but you can regulate that a little bit. What you do with that, Debbie, is what you do is you time your dosage. Most of the medicines on the market these days last 12 hours.
And can they outgrow ADHD?
Oh yeah.
Or?
Oh yeah. Okay. It's estimated that about 75% of kids who have ADHD will lose it around the early teen years, age 13, age 14.
You know what? It's so difficult raising a child these days. There's so many things that you need to know versus when we were kids, we didn't even have car seats.
Right.
And now the safety features on all the cars and all the things you have to do and the things that you could be arrested for doing. But
Well,
I know
going back to what you were saying a few minutes ago, back in the old days, they didn't have any vaccines either, by the way.
they didn't have anything. And we also didn't have children who were very obese. I mean, we have obesity now in little children as well, so that, you know, the parents really have to worry about a lot of things because kids have access to food more than they had before. So we're here with Dr. Robert Childs today, Bob Childs, and we've talked about a lot of different things concerning your children, ADHD being one of them, and we could go on and on and on and talk about a lot of things, don't you, Janine?
Yes, if
It's
you have any
difficult.
questions, you can certainly ask us on our Facebook, or you can also ask Dr. Bob Childs. He's very accessible here in the greater Hazelton area.
Well, the time just flew by. I have so many more things I want to ask him, and I'm sure you do too. So stay with us through the miracles of television. You can get some questions to us. And if you have any ideas of anything you'd like to see, please contact us. And as always, we'd like to thank you for watching us, and we'll see you next time on The Girls.